I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of the IDD Health Matters podcast. Our guest today is Kaylee Graham. Welcome, Kaylee.
Thanks for having me.
So we're coming to you from the Developmental Disabilities Nurses Association conference in Baltimore, and you're a nurse in the field. So tell us your story. Tell us about what you do in this field.
Yeah, happy to. So started out as an LVN, working at an agency in Texas. Grew into wanting to learn more, so went and got my RN. Basically just stumbled upon the profession from a classified ad that I found in the newspaper. Not super attractive, but fell in love with it. Loved caring for the individuals, always a smile on their face. Very rewarding. Worked in the LTSS setting in Texas.
So long-term services and supports, just for everybody.
Yeah.
So we're all on the same page here. Yeah.
Absolutely. Yep. So supported the ICF and home and community-based setting. Individuals.
Intermediate care facility.
Yep.
Okay.
Individuals residing in community settings that needed support from a nurse. From there, I went over to work with Enable Dental as an account executive. On-site dental services, which is vastly needed for the IDD population.
Yeah, we know that medical care can be challenging to come by, but dental care is even more challenging sometimes for people with intellectual and developmental disabilities to get good dental services.
Absolutely. Yeah. There's lack of Medicaid funding. Once you turn 21, you kind of age out of the system. Yeah. I want to say there's only about 7 states that have dental coverages on their 1915C waivers. So definitely a big gap, a little more than what I would say just general healthcare access is, for sure.
Yeah. So from there, you are now doing something else a little different,
right? Yes. So currently I am with StationMD. We are supporting the IDD population through on-demand telehealth. We provide specialized physicians. You simply make a phone call and you're able to connect to a doctor for any illness, injury, general med question. Most recently, we've stood up a nursing triage line. So trying to give our nurses a little bit of relief for those after hours and weekends. Recently went 24 hours. So my job is a nurse on-call manager to make sure that my team has the knowledge and the tools that they need to succeed.
Okay, so we've had a few other people from StationMD on before, but let's talk about the services again. So It's IDD specific telehealth type services, right? Mm-hmm. So what makes this specialized for IDD? Why are the telehealth services more for people with IDD? Great question.
So first off, kind of one of the reasons I'm here at DDNA is continuing education and learning to specialize in the field. But being a nurse in school, I think I had one PowerPoint that told me about IDD, and it was pediatrics. And so, when we bring on new physicians, they go through very in-depth training. They learn about all of the different needs, the needs that are unique to the setting. Not a lot of doctors and nurses know what a DSP is,
right.
or know what LTSS stands for, as you called out earlier. Yep. It's a very unique care setting. So we educate our providers in different methods. We actually use some of the training we get from Intellectability.
Thank you for that.
We bring a specialized physician to care for their needs.
Yeah. And so you provide physician services. So if someone has a need for a doctor, they can call and speak with a doctor who has some training and experience in treating people with intellectual and developmental disabilities, which, as we know, is hard to find. But you also mentioned something else about the nursing services and what you're doing now. Tell me more about that.
Yeah. So we have now nurses available 24/7, 7 days a week to triage calls. There's a couple of different states and areas that have really unique regulations that, you have to call a nurse before you can call a physician. So we've built in this extra layer of services. But what also makes it unique is, nurses can only function within a specific practice. Most often we can identify very quickly when we need a doctor. So with StationMD, you have the best of both worlds. You have the nurse, but then we can also very quickly connect you to the doctor to evaluate that cold where maybe that fever is getting out of control. Or
Yeah, I can see where that would be hugely beneficial, especially, some provider agencies, for instance, don't have nurses on call or available, and so they can call StationMD, talk with the nurse, and then the nurse can say, hey, wait, this is a little more significant, we need to bring the doctor in, and you can do that right away.
Absolutely.
And so that that does so many things, right? Not just make it so much easier to access care and probably more quickly than you would otherwise. It can reduce the need to transport people, for instance, to the emergency department, the trauma of experiencing an emergency department visit, and all of those different things. So certainly you can see a lot of really good benefits to that. So what has impacted you personally in working in this field? Is there something kind of, personal stories or things that you were like, wow, this is why I do this. This makes it worth it?
Absolutely. So grew up in a small town in Texas and ended up caring for one of the individuals that was in our special education program that I went to school with. Cared for him for about 8 years. And I really, in nursing practice, you only see a patient for a couple of days or a few hours. You discharge them and they're gone. But in this setting, I was able to really implement those preventative care measures and very much be impactful on the outcomes and his quality of life. And kind of seeing that through the circle of healthcare was very powerful to me, to be able to see the cause and effect of the actions that I was providing.
So was this before nursing school or after nursing school? Or?
So went to nursing school pretty early, fresh out of LVN school at 19 years old. So went to work for the agency 21 or 22. And this individual I cared for at the agency, but also went to high school with. So
that's a pretty neat connection.
Pretty severe, profound intellectual and developmental disabilities, but got to be very impactful in making sure the preventative care was there, making sure they had the access that they needed, that all those things that you only typically see a short bit of in critical care settings.
I love that you talked about preventive care, because we know that people with intellectual and developmental disabilities don't always get the preventive measures that they need. Not just regular screenings, which are certainly lower in people with IDD. There's lower rates of screening for things like breast cancer and colon cancer and all of that. But also there are so many preventable illnesses that happen because clinicians and supporters and others don't always recognize the early signs and symptoms of some condition because it looks different a lot of times. A person may present with agitated behavior and aggressiveness, and we think, oh, they just, they're doing this because that's just what people with disabilities do, when they actually may be having pain from like a toothache, or they're constipated, or they fell and nobody witnessed it, but they broke a bone and nobody saw it. And that's happened. There's so many stories like that. And that's where I think that, that extra training, that experience, that understanding can have such a huge impact in people's lives. We do this show for lots of reasons, but one of them is to help people see this as a place where you can have an amazing career that can be very rewarding and very fulfilling.
Very.
And it sounds like you've had some rewarding and fulfilling times with people that you've worked with.
Absolutely. They always have a smile on their face, and you get very personal relationships with their family members, and they're just very appreciative. And you just see that a little more in the long-term setting versus an acute care setting.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisk.com to learn more about how you can employ these tools with people you support. So one of the things that I like to do is ask guests to tell us 3 things that you think can impact the world of supports and services or improve health and wellness for people with intellectual and developmental disabilities. So name your top 3 tips that you'd like to share with everyone.
That's a very hard one.
You can do it.
Okay, so I think first off is I would just encourage everyone to keep an open mind, especially when it comes to innovation and technology. Something as simple as leveraging telehealth or by mail prescriptions, or something as simple as being able to order your groceries at home can be a huge change when caring for the IDD population. So
I love that.
Yeah,
don't be afraid of innovation and
technology. Don't be afraid of
right?
change. Whether it's making the leap from paper to electronic health records, or finding that specialized pharmacy. There's definitely services out there that can improve outcomes. Second, I would just encourage people caring for individuals, whether you're a nurse or a case manager or a DSP, make sure your team receives continuing education, that they continue to seek out knowledge and apply it to their care setting, and support your DSPs too. We have a huge shortage, so developing some kind of mentor program, encouraging them in their careers, identifying places that you can help them. That would be my second. Third, which definitely isn't last, is I just want to call out dental care again. I think that it's often overlooked when we do assessments as nurses. Stay proactive in knowing, hey, do they have a partial? Do they have a denture that needs to come out for cleanings? Following up with your resources and your community, whether it's sedation or, building those relationships with dentists, just like you would your primary care facilities. Make sure that they get the routine care that they need, because what's the first thing we see on somebody? It's their smile.
Hey, yeah.
Yeah. So, they already have so many barriers to overcome. Don't let that be another one.
I love that one. And I want to just touch on one point you said there about how, as a nurse or a physician or whomever, we don't often think about the dental assessment, because I know, if I have a toothache, I'm going to go straight to the dentist. I'm not going to call the nurse or go see a nurse or go see a medical doctor, because I know to go to the dentist. But many times people with intellectual and developmental disabilities maybe can't communicate exactly what's hurting or what problem they have. Mm-hmm. So they end up going to the nurse first or the physician first, who's not used to looking in people's teeth.
Exactly.
So we've got to think about it, right? Look at people's teeth.
Look in the mouth.
Look in the mouth. It's all connected.
Yes. What is it? Diabetes, heart disease. There's so many things that can. I was reading an article the other day that's dementia, early onset dementia. They're starting to link to gum disease. It's.
Well, Kaylee, thank you so much for these insights, these words of wisdom, and for the incredible work that you do in this field.
Thanks for having me. I appreciate it.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.